During the whole debate about the passage of healthcare reform, a lot of people who were opposed to it kept saying, look, I love my healthcare. I don't want to see it get harmed. We can't give all these people insurance. That the society can't handle all these people having insurance. What can we do that won't impair us in giving all these people access to healthcare? And I saw Lincoln last night, and I was listening to the debate about the 13th Amendment, which of course abolished slavery in the Constitution, and I was so struck because these people were saying, I don't like slavery. But really, what are we going to do with all these people if they're suddenly free? Right? What are we going to do with all these people if they're not slaves anymore? How are we going to absorb them? They may want the vote. And I can't help but think to myself, you were talking about the second wave. How can we even look at ourselves and say, we are not going to give people access to the basic minimum of health care? And when we're talking about the working poor, these are people who build our country, right? And in South Carolina, we've got a lot of them here. But that's just me venting. Okay. My question is more about this. If we reject, and this for this good one, if we reject the Medicaid expansion, right? And we may go through that slide you had about Medicaid in the original was very educative, right? Because if we reject it, I have a feeling there'll be some changes. We will adopt it eventually, right? But if we reject it, what are we going to do with the working poor? I mean, what do you see happening in the next 3-4 years?
Quite honestly, with our hospitals having to absorb those cuts regardless of our decision concerning the Medicaid expansion, I'm not sure. And I wish I did have an answer for you. I wish I had an answer for the woman that just spoke so passionately about that. As I mentioned in the presentation, thank you. That's beautiful. Thank you. Thank you, Soundman. As I mentioned in the presentation, those cuts are cuts of those type magnitudes cannot happen without some type of impact on hospital services as well as our workforce. Concerning the working poor, it was not the intent of the Affordable Care Act to have that gap created. It was the intention of the Affordable Care Act that those in poverty or close to poverty would be covered through the Medicaid expansion and everyone else through private insurance. It was not anticipated that the Supreme Court would make it an option for states. So we are faced with a new coverage gap if we don't accept the Medicaid expansion. And I wish I had an answer for the working poor. Of course, they'll continue to serve or be served in our clinics and a number of providers we have that are safety nets. Our hospitals will continue to take care of them because they are required by EMTALA, federal law, to see persons regardless of their ability to pay if they show up in our emergency rooms. I'm just not sure how much of that burden certain hospitals, particularly those in more rural areas, can continue to bear. And they don't bear it. I don't want to make that statement out there. People with private insurance and really employers, businesses, are the persons who bear that cost. At some point, the business community will not be able to continue to bear that cost share. And we'll just kind of have it come to a head. I wish I had a more clear answer for you.
No, that's what I thought.
All right.